Good morning everybody, it's Friday the 17th of July and welcome to my latest video update. The first thing I want to say is that in terms of coronavirus, today we've now reached 91 days without any new infection in the hospital, which I think is a fantastic achievement, and thanks yet again both to our infection control team and to the staff working on the front line in the hospital to keep infection out of the hospital completely under control. You will know that up until last Friday we had 2 weeks of some limited but very important visiting by relatives, and we're now in the middle of a 2-week gap. And the reason we're having that 2-week gap is for us to assess how well that visiting's gone, and in particular make sure that our patients have remained safe and there is no further infection. So during next week we will be deciding and obviously getting in touch with people in terms of the visiting arrangements going forward. We know how important it is for relatives to be able to visit their loved ones, but it's also very important that we continue to keep that restricted, under control, so that we absolutely protect our patients from any further infection. So that's where we are with COVID, and obviously I'll have more to say about further visiting arrangements next week. The other thing I want to mention is our CQC inspection. Many of you will know that we had a comprehensive inspection by the CQC, our regulator, in February. This week their final report of that inspection has come out. It's available on the website. There will also be a link to it on the letter that goes out to families. There's already been a link on a message to staff. Overall, our rating requires improvement, which is not as good as we hoped it would be, but I am very encouraged that in the report there are many positive things, particularly talking about the level of care provided by our staff to our patients and residents. And indeed, one thing we carry out or provide was actually highlighted as outstanding, which is how responsive our staff are to the needs of our patients. There are some actions within the report that we have to deal with, and certainly we will be working very hard in the coming months to ensure that next time the CQC come and inspect us, that we will get back to having a good rating. But I'm very confident about the future of the hospital. Indeed, they've also commented on how effective our infection control is, which of course has very much helped in terms of keeping infection out during the COVID crisis over the last 91 days. So that's all I have to say for now, and I will give another update next week. Thanks very much. Bye-bye.